Hi, my name is Christian. I'm going to be your provider for today. What is your name?
My name is Raquel.
How you doing, Raquel?
I'm doing well, thank you.
Good, good. So today we're going to be doing an assessment of the musculoskeletal, neural, and the abdomen. Okay, so I'm just going to ask for permission to see if you can expose the abdomen so we can do some of the basic tests.
Yes.
It's okay? Okay, so we're going to lift up. Okay, I'm going to go up here and go down here so you can expose the quadrant. So first thing we're going to do is we're going to do an inspection, okay? On inspection, we're looking at the abdomen. We're looking for any obvious asymmetry, any masses that are obvious, any possible distension or ascites, anything like that, or even looking at the hygiene of the umbilicus, okay? But everything seems to be normal, okay? So after this, we're going to be doing auscultation, okay? Now the abdomen is divided into 4 quadrants, okay? Across from the umbilical, below is the left and lower quadrant, right and left, and above that is the right and left upper quadrant. So it's divided into 4, okay? So we're going to use the stethoscope, the diaphragm. We're going to just listen in for bowel sounds, and for bowel sounds, you can have different types of bowel sounds. You can have normal, active bowel sounds, hypo or hyper bowel sounds, okay? So we're going to listen. We're going to do very lightly. We don't want to disturb anything that may be going on inside, okay? So we're going to start with that. We're going to start with the right upper quadrant. Then we're going to do a left upper quadrant. Left lower quadrant. And right lower quadrant. So bowel sounds seem to be normal, okay? So there's nothing of concern at this moment. And while we're at it, we're going to listen to the some of the arteries, okay? We're going to listen for at the aortic, at the iliac and femoral arteries, and we're going to be listening for anything like friction rubs, any humming, any bruits, anything like that, okay? So for the aortic one, it's right above the umbilicus, okay? We're just going to place it right over and listen. Okay, and the arteries bifurcate right after the umbilicus. That's where the iliacs are. So we're going to go a little bit left and right of the umbilicus, slide below it. Okay, and then we're going to go a little lower for the femoral as well. Okay. Okay, and there are no abnormal sounds at this moment. Okay, so this is for auscultation. Okay, so next thing we're going to do is palpate. Okay, for palpation, we're going to do light palpation, one hand, about 1 centimeter deep. And what we're doing is just basically going around softly, just to kind of. Now, if there is pain in any of the quadrants, you would know this by now. The patient would have told you that you're going to leave that for last. Okay, but in this case, do you have any pain at all?
No.
Okay, good. So they deny pain. So we're basically going to go around light palpation, one hand. Okay, so it's going to be a little cold. Okay, I'm sorry. I'm just going to go about 1 centimeter down. No obvious masses, no pain or anything like that. Okay, so that's good. Next, we will do moderate palpation, which will be a little deeper. And for moderate and deep palpation, you will use 2 hands. Okay, so you will do the same thing. Go over 2 hands and go over all the quadrants. All around here, the patient is denying pain. Okay, you would also palpate at the side of the aorta, looking for any aortic aneurysms or anything like that. No masses. Okay, so that's okay. And to palpate for the spleen, you're going to start at the umbilicus. We're going to go across at the costal margin, okay, diagonally, all right, to the left upper quadrant, okay. And the same thing for the liver. For the liver, we're going to start on the right side. We're going to start at the umbilicus, midclavicular, and we're going to head. We're going to start diagonally, vertically going up. Okay, on the right side. And the patient takes a deep breath. Okay, can you take a deep breath? Okay, and then when they release, you should be able to feel the border of the liver. Okay. So that is for that. Next thing we're going to do is percussion, okay? Percussion, we're going to use 2 fingers, go around the abdomen, and we're going to listen for any abnormal sounds, okay? It should be tympanic sounds on the upper quadrants and dullness on the lower quadrants, okay? So we're just going to basically go around, all right? And we're going to okay. all quadrants, okay? Okay, so nothing abnormal there. The sounds are where they're supposed to be. Now, if we want to, again, percuss for the spleen, we would do it the same way, okay? Diagonal to the costal margin on the left side, okay? And you can hear the difference in the sound. Same thing on the liver. Okay, now if you want to also get the size of the liver from here, we can start lower. You will have to mark it. Okay, we start at the right midclavicular. Okay, and we percuss all the way down on the right side. And once you hear the first difference in sound, you would mark that. Okay, and then you would start higher and work your way down. And then once again, when you hear the difference in sound, you would mark that, and that would give you the size of the liver on this side. We're also going to check for hernias at this moment while the patient is laying supine. Just going to ask you if you can raise your head slightly, where you're going to look out for any abdominal masses, any abnormal, raising that would be normally visible. So if you could just raise up. Okay, good. Okay, so nothing abnormal. Thank you. You can relax. Nothing abnormal on this examination. Okay. Now we're going to check for signs of appendicitis, inflammation of the appendix. There are different tests that we could do. First one is the obturator test. So while the patient is laying supine, we're going to flex the right knee. So what I'm going to do, Raquel, is I'm just going to lift your knee, okay? You're going to do here. Okay, you're going to hold at the ankle and above the knee, okay? We're going to rotate outward, okay? And what we're going to do is you're going to push your leg inward, okay? While I anchor at the hip. And okay, you can push in, okay? If there was any pain while she's doing this, this would be an indication of possible inflammation of the appendix, okay? So that's the obturator test. Next, we will do rebound tenderness, okay? So we're looking for pain that would be on the right side, okay? So what we're gonna do is we're gonna press down. The patient most likely will feel some pain, but if they do have a possible appendicitis, they're going to feel more pain upon a quick release of that, okay? So I'm going to press down, okay? And what we're gonna do is we're gonna do a quick release. Any pain?
No.
Okay, so it's negative, okay? But that's something you would do. Then you have Robson sign, which is pressing on the opposite quadrant. So if we're looking for appendicitis, the appendix is on the right lower quadrant, so we will press on the left lower quadrant. If we put pressure on there, it would be an indication of appendicitis if the patient felt pain on the right lower quadrant. Okay, and then you also have the psoas test. If the appendix is inflamed and it's laying on the psoas muscle, what we're going to do is I'm just going to ask the patient to try to raise their leg, okay, upon resistance, okay, and she's doing it with no problem. If indeed there was inflammation while she's doing that, the patient would, she would complain of pain, okay. And you have cholecystitis, inflammation of the gallbladder, okay. This is on the right side here. And what we're going to do is we're going to palpate, okay? And when we palpate, I'm going to ask you to take a deep breath, okay? If the patient stops breathing and complains of pain during the inhalation, this will be an indication of cholecystitis, okay? So we're just going to do that here. And can you take a deep breath? Any pain? Good.
No.
So patient denies pain, so clearly there's no indication of anything abnormal at this moment. For ascites, okay, we're going to check for ascites, the fluid in the abdomen. You're going to ask the patient to participate. So I'm going to ask you to use one of your hands, okay? You're going to put your hand right here, right in the middle, okay? Kind of make like a little bridge, if you will. And what we're going to do is I'm going to use my hands on both sides of the flank, okay? I'm going to hold on one, and I'm going to tap on the other. If there is any free fluid underneath, the fluid will travel, and I would feel it on my opposite hand. So we're going to, okay, press down right middle, okay? And I'm just going to, I'll do it again. Okay, there's no movement, so there's I think it's safe to say. Thank you. You can let. It's safe to say there's no fluid in the abdomen at this point. Okay, so then we're gonna move on to musculoskeletal neuro. Okay, so we're gonna check motor function. I'm just gonna ask you to sit up if you don't mind. We can and you always want to assist your patient as well. Thank you. I'm just gonna do a quick assessment. Okay, we're gonna check the clavicles. Okay, we're gonna check the shoulders. Okay, the joints. I'm going to check the scapula, okay? Just make sure there's nothing abnormal there. And we're going to check some range of motion, okay? Some passive range of motion. So, and also the neck. Are you able to move your neck left, right? And front and back. Okay, and can you push against my fingers with your forehead? Okay, so we're checking for strength. Okay, usually is measured as 1 to 5. 5 is considered normal. Anything less than that, it's a little bit weaker than it should be. Okay, as far as your shoulders, can you do rotate your shoulders as well? Okay, the other one. And can you stretch your elbows on both sides? Good. Okay, that's fine. You can put them down. We're gonna move down to the hips. Okay, we're gonna check the hips. Are you able to kind of twist a little bit freely? Any discomfort, any pain?
No.
Okay. Are you able to raise your legs a little bit? Okay, and can you flex, stretch out your legs? Okay, and can you do it with this one? Good, and we're gonna check the ankles as well. Okay, so can you just kind of rotate your ankles? Good, okay, good. So everything seems to be intact there. Next, we're gonna move on to cerebellar function. Okay, cerebellar function, we're gonna check for gait and balance. Okay, so I'm just gonna ask you to kind of step over here. And what I'm going to ask you to do is if you can walk, take 2-3 steps on your from here to here on your or that way on your tiptoes. Good. Okay. And back on your heels. Okay. And if you could do a quick hop for me, please. Good. Okay. Perfect. Thank you. So no abnormal findings there. Next, we're going to do a test, which is the rumbar test. Okay. So what I'm going to do is while you're standing, if you can just with their eyes open, you can move up a little bit so they can see. Good. You're gonna cross your arms, and for about 30 seconds, we're gonna stand still with your eyes open. Just stay like that. You're gonna watch for any swaying, okay, so any imbalance, anything like that. You will do it for 30 seconds, and then after 30 seconds, you're gonna do it again for another 30 seconds with your eyes closed, okay? So if you could just close your eyes real quick, we did it for 30 seconds, right? And we're gonna watch for any swaying, any imbalance, motion, anything like that. Everything seems to be good. Okay, so that's fine. Then we're gonna do pronator's drift. While you're standing, I'm gonna ask you to extend your arms for me with your palms facing up. Okay, and while with your eyes closed, okay, just stretch them out like that, and just close your eyes for me. This is pronator's drift. Okay, and her palms remain up. In this test, what we're looking for is any pronation, meaning if it would be an inconclusive test if the patient closed their eyes and their hand was turning inward. Okay, in this case, the patient is doing a good job, so there's no issues there. Okay, great, thank you. You can put them down. Next, I'm gonna ask you to sit down for me, please, and we're gonna do some coordination testing. Okay, we're gonna do finger to nose, just to see where the patient is, where the coordination. So I'm gonna put my finger here. I'm gonna ask you middle, left and right. Touch my finger and then touch your nose, okay? You can start. Okay? Good. Okay, and do it with the other hand as well. Okay. Okay, and this is with their eyes open, okay? And I'm just gonna ask you to do it one time with your eyes closed. You can close your eyes. Okay, good. And then you can just open your eyes and do it with the other hand. Close your eyes. Good. Okay, so I'm not sure if you saw, but the patient is able to do it. There was no problem there. Okay. So the next thing we're gonna do is rapid alternating movements while the patient is here. If you could just kind of move a little bit to the side, just to show the camera. I'm sorry. Yeah, maybe you could do it that way. So what we're gonna do is rapid alternating movements. Okay, so I'm just gonna ask you to place your palms up on top of your knees, and then you're basically gonna just do this movement on top of your knees as fast as possible. Good. Okay, so the patient's able to do that, no problem. Then I'm gonna ask you to do heel to shin. What I'm gonna do is just let your legs dangle and take the heel of your right leg and just go up and down of your left leg. So take your right heel and just go up and down like this on your left shin. Okay, good. And you can do the same thing with the other. Okay, so the patient's able to do that with no problems. Then I'm gonna ask you to take your thumb and your index finger, and what we're gonna do is we're gonna do a fast repetition of this, just alternating fingers. Okay, as fast as you can. Good. Good. no difficulty there. So everything sensory seems to be normal at this point. Okay, so we're going to do here. You can come back around, please. We're going to do sensory function. Okay, sensory function is exteroceptive perception. So we're going to be testing for let me get the cotton. We're going to use a light cotton. Okay, and what I'm going to do is I'm just going to expose the arms and as high as possible, and with your eyes closed, I'm going to have a cotton here. With your eyes closed, you're just going to tell me if I'm touching on your left side or right side. Okay, so you could just kind of relax your hands. Okay, you okay? Okay, so just tell me where you feel it, left or right.
Right. Left. Left. Right. Right. Left.
Okay, good. So this is intact right now. Okay, then we're gonna do superficial pain. Where we're going to use what I'm gonna do is I'm gonna use a blade, or in this case I'm gonna use a pen. Nothing. We're not looking to hurt the patient, but it has a dull side and a sharp side. So what we're looking to do is, again, with the eyes closed, we're just gonna kind of press down on the skin on different areas, and they're gonna tell us if it's sharp or dull. You understand? Any questions?
Yes.
Okay. All right. So we're gonna close your eyes. Okay, and you're gonna tell me dull or sharp.
Dull. Dull. Sharp. 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 Dull. Dull.
Okay, and you would repeat this, and just continue to check to see if there's anything abnormal. Okay, so that is that for that. We're gonna do temp sensation. Okay, we're gonna use a tuning fork. It's nice and cold. So what I'm gonna do is we're just checking to see where your perception is with temperature. Okay, so it's a little cold. I'm just gonna do it on different sides, and all you're gonna tell me is if it feels the same or if it's colder on one side or the other. Okay, so you can keep your eyes open for this. That's okay. Okay, same.
Same. Same.
Okay.
Same.
Okay, and we're gonna do both arms. Okay.
Same. Same. Same.
Okay, so the patient reports everything is the same, so therefore all the sensation is the same, all across. Okay. Next, we're going to move on to proprioceptive perception. Okay. We're going to use your fingers. Okay. So with your eyes closed, I'm gonna hold your hand, and I'm gonna hold your hand, and I'm gonna move the patient's fingers up and down. Okay, so I'm gonna move them up and down, and when I stop, I need you to tell me what position they're in. If I lift the finger down or up. Okay.
Okay.
So.
Down.
Down. Okay.
Up.
Okay, and we'll do the same thing on the other one.
Up.
Okay.
Down.
Okay, so nothing abnormal, there. Okay, so what we're gonna do is we're going to do a test where we're gonna check perception. Okay, 2-point perception. Where this is, we're not gonna go hard, but you're gonna tell me if you feel 1 or 2 when I touch your skin. Okay, you can close your eyes for me, please. How many did you feel? 1 or 2?
2.
Okay. Okay, now?
1. 1. 1. 1.
Okay. So patient was able to tell if it was 1 or 2, and you would repeat this on both sides as well. Okay. So now we're gonna take the tuning fork again, and we're gonna do a vibration test. Okay. We're gonna start from distal joints. Okay. So we're gonna start at the hands. What I'm gonna do, we're gonna strike the tuning fork. Okay. This is 128 hertz. Okay. And we're gonna put it at the joint. It's going to vibrate, okay? You're gonna feel it, and then with your eyes closed, I'm going to stop it. You're gonna tell me when I stop it, okay? So you should be able to match when I'm stopping it versus when you're saying it, okay? So let's just put your hand right here. Okay, you can close your eyes. Do you feel that?
Yes.
Let me know when I stop it.
It stopped.
Good, okay. I'm gonna do it again. Feel that?
Yes. You stopped it.
Okay, good. So you will repeat this on both sides, okay? And if there's any abnormal findings, you would look further into it, okay? Now we're gonna do cortical sensation, okay? Cortical sensation. We're gonna give you an object, okay, with your eyes closed, and we're going to have the patient identify it, okay? So to see what it is, she's gonna feel it and let us know what it is. So with your eyes closed, okay, I have something in your hand, okay? You could just kind of play around with it and feel it, and then let me know what it is.
Feels like a battery.
Good. So it is a battery. Okay, so the patient is okay on that aspect. Okay, next I'm gonna ask you open up your palm. Okay, this is called graphesthesia. And graphesthesia is I'm gonna draw a number with your eyes closed, and you're gonna tell me what the number is. Okay, ready?
3.
Okay.
2.
Good. So I did a 3 and a 2 on both hands. Patient was able to identify that. Okay. So now we're gonna do the reflexes. Okay. While we're here, we're gonna check your biceps. Okay. So you can see that there. Okay. So we're gonna put 2 fingers here, and we're gonna check for the reflex of the biceps. Okay. Okay. You should feel a little jerk on here. And then you're gonna check brachioradialis right here, which is inside of the mid forearm. Okay, just relax your arm right here, and we're gonna go. So when you strike, the patient should have a little bit of a jerk in here. All right. Next thing we're gonna check is the patellar one. Actually, no, we're gonna do the triceps. All right. We're gonna extend the arm right here, okay? Let the arm hang, and we're gonna strike it basically right above the tricep, and the patient does have a jerking movement, which is a natural reflex, okay? So thank you. So next we're gonna do the patellar. So we're gonna do, if you could just maybe come down this way for me. We're gonna strike, I don't know if you can see it, on the knee, okay? Right here. Okay, good. So if you notice the patient, give a nice little kick. Okay, so that's a positive reflex. You would do it on both sides. Okay. Then we're gonna do the Achilles. I'm gonna come on this side. I don't know if you can see it, but the Achilles, you're gonna go basically behind the heel at the Achilles tendon, and you're gonna strike that, and you would strike that. All right, and the patient would jerk. Okay. The last thing we're going to do, we're going to do a foot. Can I just remove your socket if you don't mind, please? Sure. And if you could just lay down for me. All right, this is going to be a plantar test. Okay, so we're going to check for, if you could just move back to this a little. Thank you. We're going to check for Babinski reflex. Okay, so what we're doing is we're going to strike the lateral foot all the way up to the ball. Okay, and what we're looking is for flexion of the toes. Okay, an abnormal finding would be if on this the patient expands the toes. Okay, so we're gonna do this. Okay, so there was no fanning on the toes. Okay, there was some movement where the patient closed. So this is a normal finding, and that actually concludes our examination. So Raquel, thank you very much.
You're welcome.